Dear ladies and gentlemen, how nice of you that you listen to us and listen to the Let's Talk session about bone regeneration. Today I will introduce you to our two experts on bone regeneration. The first one is Kamal Mustafa. Welcome. You are a professor and research leader at the Institute of Clinical Dentistry at the University of Bergen in Norway.
That's
Welcome.
right.
And Mariano Sanz, who is standing next to me, and he is a professor at the University of Oslo and the director of the Master in Periodontology, also in Norway. Welcome.
Thank you.
Mariano Sanz, normally the bone of a patient is used to regenerate new bone, but you are using biomaterials instead. Why is that?
Well, because when we have either a trauma or an infection or our natural teeth are extracted, bone will not reform to the same volume as before. Bone will create a defect. And that bone architecture sometimes does not allow us to place dental implants to rehabilitate the teeth that we have lost. And then, of course, we will need to do interventions to reconstruct not 100% of we have lost, but at least enough volume to be able to place implants in the proper position for restoring the lost teeth.
That's an excellent reason, but there might be even a better reason, because Mr. Mustafa, you are using stem cells to regenerate bone. What is the main advantage of stem cells?
Actually, we can't say that we are introducing the stem cell as a new therapy, more or less to replace or be more or less like another alternative to the bone graft. Bone graft procedure is, we know that it might be painful procedure. It's two surgical approaches. In our body, we don't have enough bone to be considered as spare parts. And that is the idea why we thought that maybe we could use stem cell together with the biomaterial.
Oh, you combine
We
your
combine
both
them
approaches.
together.
So it is not the case that stem cell technique is a better approach than the biomaterial technique.
At least this has been shown in some cases from the literature. And me and my colleagues, we've been working together in a review article. We have gone through the literature, and we could say that stem cell together with the biomaterial might be superior to the only biomaterial in some of the indication.
Okay. And I guess not all these techniques, or a combination of the techniques, are already available in common practice, or is, I think the biomaterials are already used, aren't they?
Sure, since many, many years.
Yeah. How many years? Approximately?
Many years. I
Many
mean,
years.
we can go back to the Egyptians. They were already doing some bone regenerative approaches. No,
but they are also that technique is being enhanced.
Sure. And also, I mean, about 25 years ago, I would say, the state of the art for bone replacement grafts was our own bone.
Exactly.
To remove pieces of our own bone and to place it in another place. Which was very traumatic and still is used in some specific. But more and more, the advancements in biomaterial research has made us available very good biomaterials that can substitute the bone that we have lost.
Exactly. And do you call them synthetic biomaterials, or?
We call them in general terms bone replacement grafts.
Okay.
And these bone replacement grafts can be synthetic,
yeah,
or can be natural.
natural, yes.
And the natural normally are bones derived from animal sources, from cows, from also horse.
Yeah.
And also we have used in the past human bone from donors.
From donors.
But this is very restricted, at least in Europe. It is not available to be used unless you work in a hospital that is has capability as a tissue bank. Then you can use human bones, but not is something that in Europe is done regularly.
Okay, okay. But the idea of using stem cells is not yet used in clinical practice, is it?
Because there are certain phases you have to go through all these phases to introduce a new therapy. Maybe you could think about we are introducing new drug, for example.
Yeah.
So we have to go through all these steps because we say that could be used routinely as a hospital.
Yeah.
So what we could say, as I presented yesterday, we treated 11 patients. And this could be considered as phase 1, phase 2 clinical trial.
Wow.
And now we are together in another EU project, which is called MaxBone, which phase 3 clinical trial, where we are having the bone graft, which is a gold standard treatment, as Mariano said, as a control. And if we could show that this new procedure is effective and efficient as the bone graft, then we can talk about introducing the treatment as a routine treatment at the hospital. So we have to go through these steps according to the regulation.
Ah, okay. It's about the regulation. But I understood from your talk that harvesting of these stem cells is still very invasive for the patients. Is that right?
I didn't say that it's very invasive, because if you compare that to the bone graft material from the LA crest, it's less invasive.
Oh.
Absolutely.
Okay.
And it's only one surgical procedure under local anesthesia compared to the harvesting the bone under general anesthesia.
Okay.
So,
but,
yeah.
Yeah. But is it because when you compare it to the use of biomaterials, it's still very expensive. It takes a lot of time to grow these stem cells. Is there any, can we speed it up a little bit and make it better?
I think in all the scientific environment, one of the main objectives is to reduce the cost of the stem cell treatment. Today, I could say that is expensive compared to other type of treatment, but again, it's something that is new.
But also it's important to understand that biomaterials nowadays only work in small defects. When you have big defects, is basically when we are utilizing the stem cell combination. Because you need the added value of the stem cells to grow mostly on a vertical dimension. Because nowadays when we want to treat big defects, the standard of care is to take big blocks of bone from the patient to put it in another position.
Yes.
And this is very invasive. So what we are trying is to come with a new therapy that is less invasive, but at the same time is good enough to overcome the problem of size.
Yes.
Size matters.
Size matters. That's an excellent message for everybody who watches. Another one, adding bioactivity to synthetic materials is also one approach to make the technique better. Can you elaborate on that?
Sure. Nowadays, there are lots of research in new biomaterials that have both physical and chemical properties that will enhance not only cell attachment, but cell differentiation towards bone-forming cells.
Okay.
Most of these biomaterials have not reached the clinical availability yet.
Yeah.
They're still under investigation.
Okay.
But our talk yesterday was to talk about the future. So
let's do that. Yes.
In my opinion, in the future, we will be utilizing more and more these synthetic, we call them composite biomaterials, because they're a combination of ceramics, like our bone is a ceramic, calcium phosphate ceramics, and polymers.
Okay.
And these combinations will have potentially beautiful properties towards cell differentiation and towards bioactivity.
Okay, okay. So, do you think these techniques will make the life of dentists and the life of patients easier?
I think, in general, dental implants improve the quality of the life of the patients. And if we provide the dentist or have a method or a treatment that improves the quality of the bone, regenerates the bone with less invasive procedure, by using cells derived from the same patient, I think we will have some significant impact on the quality of life of the patient.
Okay, and for the dentist?
And for the dentist, of course, because again, they will use less invasive procedure.
Yeah.
They will feel much better when they have bone quality that would stand the procedure of the dental implant in the future.
Yeah, yeah. So if I would have 10 million euros right now in my hands, and I would give it to the most promising technique for bone regeneration, would it be adding bioactivity or adding stem cells? Or is it not possible to separate
Why
them?
don't you put 5 million in each hand?
You want to share it?
Yes. No, we are working together, because you cannot really dissociate the cells from the biomaterials.
The biomaterial gives the right signaling to the cells to decide or determine the behavior of the cells.
Yeah.
So if you have the optimal material, then the outcome that you might drive the cell into the right direction. You know, stem cell could be derived in different ways.
Yeah, so we always have to...
Still you need the biomaterial. So you need the biomaterial, you need the 3D environment, which is provided by the biomaterial.
Yeah, I understand. So we have to collaborate, work together,
and then and that's why we are working together.
Gets easier for patients and dentists. Yeah. Thank you so much, Mario Sanz and Kamal Mustafa. Thank you so much for being here in the studio with us today.
Yeah. Thank you.
And thank you for watching Let's Talk. Please subscribe to our YouTube channel if you want to see more of these Let's Talks. And please come to the conference next year.